Welcome to the emergency room. I'm going to give you the quick who, what, when, where, why for COVID-19 that you're hearing about everywhere. Who? We're worried about patients with fever and cough with travel in the last 14 days to the Middle East, Europe, or Asia. Those are the patients that we're worried about here in the emergency room. And we're worried about the vulnerable groups, those over 70 years old, those with COPD, chronic obstructive lung disease, or congestive heart failure. Kids, we're not quite sure. Kids get colds a lot, and cold is a coronavirus, so they may be partly immunized already or partly protected, so we're not quite sure. Let's talk about the what. Coronavirus 2019, or COVID-19. It's a novel coronavirus, which means we don't know everything about it yet. We know that it started in Wuhan, China, in some sort of animal market. It spread from animal to human, perhaps mutated, and then now goes from human to human. And it's excreted maximally in the first few days when people aren't even that sick. And it has a lipid core around it, which protects the virus. So a little bit of heat will not kill the virus, which is different than influenza. That's why the flu is seasonal. It's passed by droplets. And the big what is what's going to happen. Nobody knows. Perhaps, the experts are saying 1/2 of the United States will get infected with a maybe 2 to 4% mortality rate, maybe 800,000 to 1 million deaths. Nobody knows. Follow the CDC and the World Health Organization websites. Who, what, when? When, we talked about the 14-day incubation period. That's what we're worried about now. Maybe in the future, that travel won't be required and people will just spread it to each other in the United States. Where? So those traveling to those regions that I discussed earlier, Europe, Middle East, Asia. I'm recording this on March 12, 2020. This information is always changing. Why? Why are there travel bans? Why are sporting events shutting down? Why? The answer is, which direction would you rather be wrong? Would you rather be overly careful and shut down things, which does have financial implications, but may protect more people? Or would you go the other direction? So we're doing the best with the information that we have. And finally, I'd say there are some positives about this as well. Remember, as a military veteran myself who went to Iraq, our military was not as prepared before Iraq because we hadn't gone to major war since Vietnam, and we ramped up our military. I published a publication in the Huffington Post in around 2017 that stated that we're not ready for a pandemic or a microbe. So if not anything, this may be a great drill for us to prepare us as a nation for these sort of pandemics. So that's the positive side. The other positive thing is if you're only a little sick, tickle in your throat, sore throat, a little bit of coughing, you don't need to come to a facility like this. Stay at home. There are documented cases of people waiting in line for SARS testing back in the day, and they caught it while waiting in line. The other good thing is with simple precautions, washing your hands, coughing like this, not into your hands, keeping your immune system strong with exercise, sleep, and following these precautions, avoiding overcrowded places, not coming for testing when you're not sick, you may actually be able to keep this at bay. And finally, let's talk about the testing. There's a lot of frustration that there aren't enough tests, but we don't test everybody. We are only testing the vulnerable groups and those who have that travel. So we don't know the true denominator of how many people have this right now. And as we test more, you may hear in the media there are more and more cases, but that's just the denominator getting bigger. So remember the facts and facts over fear. Stay healthy.